Hi, my name is Vani Sassetti, and I'm a clinical specialist in women's health, physiotherapy, and well-being. Today, I'm very excited to welcome you all to Women's Health. Let's talk more. First of all, before I do that, I would like to introduce you all to my lovely friend Helen Nichols, who's a retired health screening sister, as well as she worked in women's health, say it was as a midwife and also in health screening. Overall, about 40 years of experience, I would say. Hi, Helen.
Hello, Vani. Hi, thanks for inviting me.
You're very welcome. And I'm really grateful that you agreed to join us today on this talk.
Yeah, my pleasure.
Right. So what is it all about? What's women's health? Let's talk more. The concept is really simple. All we are trying to do here is bring more awareness about women's health. So we just choose a small topic, and I would say that topic would be the most unpopular topics for women rather than the most popular topics, because everybody is interested in talking about the popular topics, but there are some topics women tend to not talk about, but these are very important for women's health and well-being. So I would like Helen to start off introducing what we're going to talk today.
Right. So, well, we're hoping to have a discussion about the indicators of our health that we notice and that we act on. So, for example, there are quite a few external indicators that we notice, and we're perfectly happy to talk about, like our hair, the condition of our hair, the condition of our skin, this sort of thing. There are also a few less visible indicators, and we're not quite so happy to talk about them, and they tend to be things like our bowel function, our bladders, how our bladders are working. So I think it's pretty useful to have the chance to compare the two, really, and look at why we're happier to talk about one, not the other. But you're certainly a specialist in those less popular areas.
Unfortunately, yes. So as we already mentioned, the main reason we are doing this is to bring more awareness and for women to feel comfortable to talk about these, because it does help them a lot. So we're not too much worried about the most popular, the hair and the skin, because everybody knows about them because we always talk about these. Whereas we want to focus today more on the unpopular ones. So we are going to pick the bowel and the bladder rather than talk about hair and skin care, because most women know about it, or they're happy to chat to their friends. They do have that regular care about your face, skin, or your hair, whereas we don't tend to focus on bowel or bladder. So if we come to the bowel first, so what are your thoughts on bowel health, Helen? Because the main two things when we think about bowel is about either constipation or diarrhea. Those seem to be the symptoms most women know, but they need to know more about those.
Yes,
so what would you say?
Yeah, it's amazing how often these problems came up in the consultation room. So it is quite a big deal, and I think as far as our bowel function goes, a lot of us have tended to accept that, well, this is just a normal part of, and we really, we don't have to accept these problems. A number of women suffer quite badly from constipation. And there are lots of reasons for this. I mean, from the time that our periods, really, all through our reproductive lives, we are controlled by the balance between our estrogen and our progesterone. And at certain times of the month, progesterone gets the upper hand and it relaxes the smooth muscle in our body. So our bowel isn't moving things along quite as well as it at other times in our lives. So constipation's a big issue for women. And also, we don't always drink as much water as we should do for lots and lots of reasons. And fluids and exercise are absolutely at the base of our healthy bowel function. When I was a trainee nurse many, many years ago in the 70s, we had a fierce old sister tutor, you know, who used to have strings, a cap with strings underneath. And she used to say, every time we saw her, she'd say, the key to good bowel movements are fluids and exercise, nurse. And we'd all have to say, fluids and exercise, sister. And it stuck with me. But, you know, it's a big part of our bowel function is the amount of liquid that we're drinking. And on the other side of things, diarrhea, IBS. Huge percentage of the patients that I saw in health screening were suffering from IBS, and a lot of that's linked to our stress levels. And you know, again, that can have a big deal on our lives. I imagine you've seen something very similar in your practice, yeah?
Again, in the last 10 years, would you say IBS has become like, I would say every other woman you see has got IBS, some sort of IBS symptoms, whereas I'm sure like 20 years, 30 years before, you didn't hear that much or like that many women suffering with IBS.
No. I'm not 100% sure whether it's because the prevalence is greater or just because people didn't talk about it. Probably a bit of both. You know, an awful lot of people years and years and years ago, if you started to talk to them about it, after they got over the initial, you know, they would say, actually, yes, this has been a problem for me. Now, thank goodness, we're a little bit happier to talk about it. But then by the same token, the stress in our lives has gone up massively. We're all overstressed. When we're stressed, we breathe more shallowly, we dry out more. So, you know, we dehydrate and, you know, stress.
It's like that vicious circle, isn't it? It's definitely a vicious circle. Like when I see patients, that's what I see. When they are constipated, there could be so many reasons why they are constipated. So as you already mentioned, yes, fluid intake and exercise could be the main reasons for having constipation. But when they have prolonged constipation, what happens is their pelvic floor starts dysfunctioning as well, because they're not going to use the muscle in the same way as they would have used the muscle during a normal bowel movement. Because it be a constant straining of the muscle, or it be the tension or the worry about the pain. So slowly, as you struggle with constipation for a bit longer or are chronically constipated, these women tend to have pelvic floor dysfunction. 50% of women who struggle with constipation actually end up having pelvic floor dysfunction. And that's a big number when we think about, we don't really take constipation as a serious issue until it's really bothering us. Like if you're really going into retention or you really struggle with pain, that's when women tend to go. But a lot of times you kind of ignore it or kind of put it down as, oh, it's normal for me, rather than doing anything about it. And a lot of women, when I ask them, oh, okay, why did you not do anything about it? Or like, why do you not drink enough fluid? It comes back to, they're worried about the bladder to drink more fluid.
Yes. Oh, absolutely. Yeah.
Yes. So they say, oh, I'm worried about going more often to the loo, like going for a wee. So what I tend to do is keep my fluids less, so that I don't have to worry about thinking where is the loo, or when I'm traveling, or say when I'm at work, things like that. And that in turn is affecting their bowel, because they need fluid for that. That's the main reason a lot of women don't drink enough fluid, is the worry about needing the loo and not actually making it on time.
Yes, yeah, and it becomes quite a psychological issue as well. We do worry. I mean, I worry about it because I'm older, postmenopausal, and I always seem to be going for a wee. And we can get into a frame of mind where we think ourselves into needing to go to the loo more often. I know women we do go to the loo more than men. We do wee more often than men, but evidently that isn't, because I always thought years ago that we had a smaller bladder than men, but that isn't actually true. Our bladders are roughly the same size as men's bladders. It's just that there are more structures inside our pelvis, so there's less room for the bladder to expand. So when our bladder gets a bit full, we're uncomfortable more quickly than a man would be, because there's very little inside their pelvis. So
and when it comes to like the bladder is being full, or like you're drinking some fluid, not necessarily you're holding a lot of fluid in there, but say you're constipated, or your bowels are full and you're not able to open it, what happens is that causes pressure forward, and it actually presses on your bladder. So then the bladder capacity automatically decreases and your frequency goes up.
Yes. So you imagine there's something wrong with your bladder, whereas in fact, it's your constipation. So if you could deal with the constipation, the positive cycle starts and things sort themselves out. Yeah.
Exactly.
And limiting our fluids as well contributes to more urinary tract infections. And sadly, women get a lot more urinary tract infections. We're not that good a design in terms of our urinary tract. We're much more susceptible to infections. And I think it's something like a quarter of all women have more than 2 bladder infections a year. That's a big number. That's a lot of women suffering. And again, probably suffering in silence, because it's not something we talk about unless we absolutely have to.
Yes.
So, it's another big deal that we almost accept as something we'd have to put up with rather than talk about it.
Definitely. And when it comes to bladder, it's also it's about that taboo, isn't it? We generally don't like to talk about bladder or bowel, things like that, and we almost made it a point that we accept it as it's a normal, rather than it's a problem, because nobody talks about it. It's meant to be, it's not a problem, it's okay, or it's normal. And the number of times, like say when I'm seeing patients through a GP referral or a consultant sending, and the women say, the letter says, this lady has incontinence, so can you help with that? And then the lady comes in, and when I actually talk to her, or when I'm going through the assessment, when I ask them, okay, so do you struggle with incontinence? The first answer would be, of course not. No, I don't have any incontinence. And then as the questions go, and we talk about, what about when you cough or sneeze? Is there any problem? And then they go, oh yeah, I just would have a little bit of a leak. But that's normal, isn't it? That's not a problem.
Oh, yeah. Again, this is something that we've almost accepted that as we get older, these are things that are going to happen to us. Our bowel function won't be quite as good. Our bladder function won't be as good. We're going to have problems. We're going to have leakage. And, it's not that way at all. We really don't have to put up with these things. If it were one of our external indicators, like, if our hair went terribly dry, or if, when we get a spotty skin, we don't feel we've got to put up with that. We will go and get it sorted out. But these hidden things, we can be very reluctant to consider them. I suppose it goes back to the old days when women's health was not a very popular subject, and a lot of GPs were men. And I can remember when I was small, my mum sort of moaning because you go along to your doctor to talk about women's issues, and he'd sort of say, oh, well, it's just your age, dear. Very patronising. We don't like to be patronised now. So hopefully.
Yes, it has changed. Definitely more women are aware and they are happy to talk, but it's still a lot more needs to be talked about. And more than anything, more than the taboo now, I think it's lack of awareness. That is where the problem is, because when I see women, especially the chronically suffering women, and they suffered for years, and by the time they come to see us, and I always ask them, why did you not do anything about it? Like, because you're talking 4 or 5 years of history, or like 10, 20 years of history. Yes. When they go back, they talk about, oh, this is when it started. Or, oh, it's like, why did you not start then? Why did you actually put up with it? And majority of them say only one thing. It's like, I never knew that there is something you can do about it. Or I just thought it's normal because I had, say, 3 children or 4 children, or because I'm going through menopause. I thought this is actually normal until now.
Yeah. And of course, a lot of the menopause changes do cause greater relaxation amongst our muscles. The estrogen dies off a bit, so the progesterone becomes stronger, and progesterone relaxes smooth muscles. So we do get all these issues. We don't have to put up with them. It was almost like a joke in bygone years, that, oh, well, of course, you know, you're menopausal, you're postmenopausal now, all these terrible things are going to happen to you. Oh, well, there you go. No, we don't have to suffer these things. There are loads of healthcare professionals available who will advise us. And like you say, if we can start early, if we can start what's going on in our bodies, start to recognize that it is a big deal and that we don't have to put up with them, our lives are going to be that much sweeter, that much easier. I certainly have noticed over recent years how many women have been suffering from painful bladder syndrome, and whereas, you know, a few years ago it was a massive problem in their lives, and they were having lots of they'd have medication, they'd have lots of procedures done. There seems to be a new emphasis now in management of
definitely
pain.
Because the way we are looking at a patient has completely changed. I would say probably in the last 10 years, or not even 10 years, even less than that. So say about 10 years ago, if we have a patient, either they have a physical problem or a mental problem. We never join those two together.
No.
And
they're the two sides of the same coin.
Yes, you either will be in this basket where you are like, okay, you have a mental health issue, which can be like, oh, because you're depressed, oh, because you're anxious, that's why you're having all these problems. But or the other way around, right? So if not, it will be like, yes, you have arthritis, and we just treat you for arthritis. That is how we used to look at it. Whereas now, the science, the medical world is changing a lot, and we are accepting that actually when a patient comes to you, there are multiple factors. We didn't know this before, but it's about bringing that together is what's happening more and more now.
Yeah,
thank goodness. You go to your GP, even then, it's not like they wouldn't just say, oh, just take this medication and go away. They are also encouraging, okay, go see a specialist or somebody, and they can do something about it. And even years ago, when a patient comes to us, we are also, in a way, scared to say things like, yes, I can see 50% of your pain is coming from that physiological change in your joint or in your pelvis, and 50% is actually coming from your head, which is more because of the stress you're taking, things like that. We wouldn't dare to say that in those days, because then the patient goes, are you saying that I'm just making this up?
Yes, and they'd be insulted. Whereas we're much more ready now to say to the patient, right, there are lots of ways in which we're going to manage this condition.
And they can understand that. They are more.
Yeah. And of course, if we have got a problem going on, if we are in pain, if we are being inconvenienced to any great extent by something that's going on in our bodies, then we have this, human beings and animals have wonderful capacity to notice what's going on in our bodies and respond to it. So, you know, if we're in pain, our brains will go to that thing and amplify it. The more attention that we give to it, the more it hurts. I'm not saying that just distracting ourselves from something will make it better. That's not what I'm saying at all. But certainly the way that we respond emotionally to being in pain or being inconvenienced makes a big difference to how well.
Absolutely.
And there are other aspects, like, you know, part of the management will be how we respond to pain. Part of it will be lifestyle, diet. Are you getting enough sleep? Are you eating the wrong things? With bladder pain syndrome, I know that diet can be a huge issue. Things like caffeine, alcohol, acid things sometimes, too much fruit juice.
Everybody reacts for different things as well. So that is, again, comes down more to individual patient, individual responses, really. And it can't be generalized, because why they are getting that bladder pain syndrome is multifactorial.
Yeah.
And every patient has a different reason why they have that flare up. So we got to look at that particular factor and then work backwards in a way. So go back to the cause and then teach them to manage the cause, or actually treat the cause. So we're just not treating the symptoms anymore. It's more looking at the holistic approach. And things like, even in the last 5-10 years, it be mental health, or it be even like yoga and meditation, these have become really acceptable.
Yes,
it's okay to talk about them. Everybody is happy to talk about them. And whereas 10 years ago, you got to be in a cult or something to do yoga or meditation. Especially men would be like, what, meditation? No way.
No. And yet all the big companies now, that particularly the sort of global companies, a lot of them are encouraging their high flyers to sign up to meditation apps and things. You know, it's quite acceptable now to say, well, I'm going to go away.
It is acceptable because awareness, because they talked about it for so long, and people actually saw what it can do, experienced by themselves, and then it's like, oh, okay, it does help, rather than thinking, oh, what is that? We don't do that kind of stuff. The same thing happened with mental health. It's really good awareness out there now compared to a few years ago. It's almost like that cultural thing, isn't it? You got to be strong. You just have to put up with it, chin up.
Yes, there was almost sort of kudos in being stressed at one point. And of course, when we're stressed,
not able to deal with it.
That's it. Yes. But if we're stressy, we produce adrenaline and cortisol, and these two chemicals are causing an awful lot of the stress reactions in our bodies. And if you sit down to meditate, you switch off your production, you switch off your cortisol for a little while. So, even if you get 10 minutes without these things coursing through the body, it's bound to improve sleep, improve our response to things.
Health, definitely. So the same thing has to happen with women's health as well. That's what we're all trying here, is to bring that awareness. It's okay, and to talk about it. And of course, you will have problems with your bowel and bladder, just like anything else as you age, because arthritis, because you're using those joints, wear and tear. You're using your bowel and bladder, so it's going to be having some issues. So we got to maintain that. If we are accepting that our skin needs care as we age, our hair needs extra care, joints need extra care, we're doing all that, right? We apply this principle of prevention is better than cure in every other aspect, or the visible stuff we apply. When you think, oh, I'm reaching that age, so I got to exercise more to keep my joint health better, or oh, I need to apply more wrinkle cream, anti-wrinkle cream, because I don't have wrinkles, things like that. But that's all prevention.
Yes.
And the simple question is, if anything is being used, it needs maintenance. Not even your body. Think about your car, your bikes. Every year, you maintain them. You take them for an MOT.
Yeah.
Why is that? There's no problem with your car, but you get it checked and make sure if there is any small signs like, oh, the tires are wearing out. What do? You take care about that.
Yes.
The same thing has to be applied to our body as well.
Very
you can replace your tire. You can't just say, oh, okay, I'll just throw my bladder out and get a new one.
If only. But no, we need to respond more readily to these flags, to the clues that there's something untoward. Not just accept.
Don't worry about those the words, big words like incontinence or prolapse, things like that, because they're just medical terms. In simple, you're using those body parts and they just need maintenance. That's what it is. And the same thing applies with bladder incontinence. A lot of women think that's normal, but it's just common. That is what it is. But it's not normal to have a bit of a leakage because you're going on a trampoline or not being able to make it up to the loo on time. Urgency or urgent incontinence. These are all interlinked things which we look at individually, and a lot can be done about it. And it's about that quality of life you can have rather than just hiding away with a tenor lady. Of course, because these are internal, there's every choice, like, okay, I can put up with it and have a tenor lady, go for my exercise class. So I'm still doing my exercise class. So externally, I'm keeping up everything, but internally, I'm hiding something, which is my leakage, right? The same thing can be done internally as well. You can look after your internal health the same way as you're looking at your external health. So it's not like tenor lady is the answer for everything. Think about your older generations, our nans, grands, who are some of them in the nursing homes and stuff. Think how much incontinence is a problem in the nursing care with the older generation.
And hopefully there won't be nearly such a problem in the future, because these things are becoming more easy to talk about, we hope.
Definitely. And I think definitely women are coming more. Recently, I have seen few women saying like, oh, I don't want to be in that position. So they are thinking in that way, like, I need to prevent. So they are coming much earlier rather than later. And always remember, it's not all about what you're doing now. It's almost like what you've done before. So for our older generation, it's not necessarily what is going on with your nan or grand's bladder now, but it could have been she's never drank enough because she never knew she needs to drink enough fluid, or she has been a chronically a lady and ended up having prolapse after menopause. Right. So as we already are mentioned it, the main reason we are doing this women's health, let's talk more, is to bring more awareness in women's health so that it just cuts down the suffering for women who actually are suffering because they don't know about this. And they don't know that something can be done about this. And there's so many conditions we can talk about. And we are quite happy for women to come up with the topics they want to know more about. It be prolapse or it be about menopause, things like that. We are more than happy to pick those topics. So please let us know if you want us to specifically talk about any of those topics in women's health, if whichever you feel like, oh, we want to know more about this. And thank you very much.
Thank you. Thanks for having me.
Thank you, Helen. Thanks a lot. Bye-bye now.
Bye-bye. Bye.